Ladies and gentlemen, we're here with Dr. Frank Anthony, Minister of Health. 2 days ago, on the 17th of January, Minister Ashni Singh, Dr. Ashni Singh, tabled uh, the 2025 budget, a secure, prosperous, and sustainable Guyana. $143.2 billion was allocated for health. How do you plan to spend that money?
Well, first of all, thank you very much for having me on the program. That's quite a lot of money, but it's going to do a lot of good for the people of this country. As you know, over the last couple of years, this government has been doing a lot of investment in the health sector. And a lot of the things that we've been investing in has to do with how do we improve the health of our people. So we have looked at programs to do prevention, but we've also been improving the quality of the services that we have been delivering. And in this budget, you will see a lot of those services continuing, improving, expanding. And of course, one of the new features in this particular budget is one that His Excellency would have announced sometime prior, and that's the Universal Health Voucher. So provisions have been made in this year's budget for us to roll out that program. And through that program, you would get a voucher worth $10,000, and you can use that to get various types of tests that you would need. So I think that's a very innovative and good program to have.
Yeah. Let's run through some of the items.
Sure.
Six new hospitals. Tell us about that. What are the chances of these being commissioned, opened, completed this year?
Yeah, so we have a very ambitious infrastructure program which includes um, 14 hospitals, but we're working to conclude six of them this year and to operationalize them this year. So the six that we want to operationalize this year includes the Diamond Hospital and more, Bath, number 75, Dekendron, and Lima. So before the year comes to an end, all six of these would be operational. Now these hospitals, what would you have in them? Basically, you would have a 24-hour accident and emergency, labs to go with it, so 24-hour labs, imaging facilities that would be operating on a 24-hour basis. And the imaging, we have expanded what we are offering. So apart from X-rays, that is now digital, ultrasounds. We'll also be at each of these hospitals. They would have their own CT scans. So you no longer have to travel from huge distances to come to Georgetown to get a CT scan because this would be done at your regional hospital. Apart from this, we have a number of inpatient beds, 75 inpatient beds, three operating theaters. One of those theaters is located in the accident and emergency. So a lot of the trauma cases, we can actually do it in the accident and emergency. And we have two operating theaters on the second floor of the hospital. You have a beautiful birthing suite. Um, so that's a good thing too. And with the most recent announcement that every child born of a Guyanese mother, you'll get 100,000. I think with the opening of these hospitals and the birthing suite, it would help with that.
So tell me, talking about birth, and tell me about the hospital, the maternity hospital in Ogle. When is that likely to be open, commissioned, and up and running?
So that one is a major undertaking. It's 252 beds. So we have 100 beds for complicated cases, maternal cases, and the rest basically is for children. We've been working with a company, and hopefully we'll get that up and running within the contractual period. So it's a very complex facility because in that one, apart from all these things I mentioned for the regional hospitals, we're putting in there an MRI, we're putting in a cath lab, so we can do very complicated cardiac interventions and so forth. So there are lots of new features, things that we never had in this country, that we're putting in there. So it's going to take a little bit of time for us to get all of that in
Yeah.
place.
And then there's also in remote areas, Latam, I think, Lima, uh, or Lima, and there are other facilities, hubs, places where people. I think you were up in Maruka recently, or
Yes.
you opened up a facility there, or commissioned a facility. Tell me about the remote areas, the hinterland region, and coverage there.
So if we stay on the theme with the hospitals, so apart from the six that we're recommissioning, we are also doing a hospital at Maruka in Region 1. We're doing one at Keto. We're doing one at Letem. We have put out a bid for one at Camarang. Unfortunately, nobody bid on that, and I think the terrain is a little bit complex for people to get the materials in. So we are working to redesign that and to see how we can get that up and running. We have also looked at Bartica, and we are hoping that we can get that one started as well. The more bigger ones that we have, West Demerara would be starting soon, and that's going to eventually replace the existing West Demerara Hospital. Um, we have the New Amsterdam Hospital, that too. Right now we are putting in the foundation, so you'll get a new New Amsterdam Hospital. So these are just the hospitals. We have also been working on health centers and health posts, and we have quite a few of those that we have built over the last couple of years, new ones in places that were underserved, and we continue to do these.
Uh-huh.
This year, I think we probably have another 5 or 6 new health centers and health posts that we'll be constructing and bringing into operation.
I read about these boats as well,
Yes.
that you have like a clinic almost. They can deliver vaccines, can do tests. There are two of them. Do you
Yeah.
have plans for more this year? I mean, some of the areas are only reachable
By boat.
by boats.
Yeah.
Tell me a little bit about that.
So, I think one of our best programs that we have in the health sector is our immunization program. So we do 19 different antigens, and we usually get between 95 to 100% coverage, which is extraordinary. So the nurses and community health workers, they go that extra mile. They go look for that last child and make sure they get their vaccines. And one of our challenges would have been in riverine communities. So these boats are equipped with cold storage, so you can have your vaccines on board, and it's at the right temperature. The refrigerators are powered by solar,
Mhm.
so
Wow.
it's really nice.
It's compact.
And so we were able to move around to riverine communities and do the vaccination, and that has been a real help. So we'll evaluate how these two boats work, and once we see the benefits of it, we'll replicate them and put them in other areas, because certainly reaching these communities are very important to us.
Mm. You know, hospitals, clinics, hubs, boats that can service communities in terms of health, all of these things require staffing.
Yes.
And with this kind of investment that we're seeing this year, what tell me about nurses and about specialists and about doctors and so on, beyond equipment and infrastructure,
Sure.
these places have to be staffed.
Yeah. So think about this. So first of all, for each of these new facilities that we're opening, we've had a number of expert teams that helped us to put together the staffing structure. And we're working to make sure that we meet that requirement. We have been fortunate to work with a number of partners. So let's take nursing. Before, our capacity to train nurses were very limited. We were only able to train maybe about 200 nurses per year at the 3 schools that we have. One of these schools are in Linden, one in Georgetown, and one in New Amsterdam. But the combined output of these schools are about 200 nurses, and that's really not adequate. So about 2 years ago, we came up with a new idea of how to do the training, and we have partnered with Coursera. So they have given us their online platform, or we have a portal on the Coursera platform, and all the functionalities that you have on Coursera to monitor somebody's coming to classes, how much time they spent, whether they're reading the material, and all of that. So all those functionalities we have through this portal. And we then work with our tutors along with a WHO collaborating center out of Brazil, the University of Sao Paulo. And we have been able to bring their faculty to Guyana to work with our tutors. And we have now moved our curriculum that we do for nursing online, and we've put that on the Coursera platform. And we have started a cohort last year of training nurses, and we currently have about 1,000 nurses from that first batch. They're now in their second year in training. This program is a 3-year program. So they're now in their second year of training. And, well, not last year, in 2023 we started. So they have now completed 2 years, and they're now going to be going on to their third year. And last year we took in another batch. So we have approximately 2,000 nurses on this platform doing nursing. So while they would get their theoretical material and training online, we are now, when they complete the theory, we are able to bring them into 10 simulation centers that we've developed in every region of this country. So you come there and you'll get your practical training. So after every semester of theory, you come in, you do practicals. So you're getting both theory and practice.
Right. So by the time they graduate, they're ready.
By the time you graduate, you're
ready to be placed.
ready to go into the hospital. So that's how we have approached it. So we have revolutionized the way that we are training. And what is important is that the funding to get the people from Brazil to come and work with us, this was funded through the WHO on an initiative from the Director General, Dr. Tedros. And that's how we've been able to get this collaborating center to send these tutors to us. And they're using this as a model because, as you know, there's a problem with nurses migrating, but we don't have many answers of how to stabilize our training and get more people trained. And so this model, everybody is looking at it as a good example of one way in solving some of the problems that countries have. So we are very pleased and we are happy for that collaboration. And we have now, since we've started this professional nursing program, and ours is a little bit unique because while our nurses are on training, they get a stipend. And when they finish and once they successfully pass their exams, they have a job with the government. So all our nurses would be employed once they pass their exams.
But you still have this issue of where they're located, right? I mean, you might have a surplus of nurses, say, for example, in region 6 or 5,
Yeah.
but you need them in region 4.
I'm happy you asked that question because, you know, one of the things that we've done is telemedicine.
Right.
So we have 89 sites now in regions 1, 7, 8, 9, 10. And so people have access in these, what we call our hinterland locations. People now, for the first time, they have access to the internet. And because the training is online, once you can enroll, and you don't have to leave your village, you just go to the health center near to you, and you would access all our programs. So you can stay at home and train. And we have seen that that has made a difference because in every region now, we have professional nurses in training.
Excellent.
So once they complete their training, they'll be working in the hospital nearest to them.
Let's go back to telemedicine because that's a big item in the budget, and I imagine that doesn't come cheap.
No, it doesn't.
And because that's a technical, modernized, like, I mean, you have to build out a system for that
Yes.
to work. So tell me what to expect. What can Guyanese expect in 2025 with this new budget? What are you going to be able to do in the area of telemedicine?
So currently we have 89 sites in and around these regions. So first of all, we want to expand that. So we're hoping that we can double that. And so that's one of the things we'll be working on. In addition to that, the things that we do using telemedicine is one, video consultations. We have, at each of these sites, we have a number of internet-enabled devices. So you can be 500 kilometers away and you contact one of the doctors at Georgetown Public Hospital, and they'll be able to see your ECG in real time or an ultrasound. So by doing that, we're able to make remote diagnoses, and if the patient is critical, then we can send in a medevac to bring that person out. So it serves both as improving the quality of medicine that we can practice remotely. That's one. Two, it can help us to do the communication. So if we have to do emergency medevacs and so forth, we have a reliable way of communicating. And three, we are using it to do this education. And then as another ancillary service, basically anybody from the community can come to our facilities and they'll have internet connections. But we have programmed the system in such a way that it allows for, if we are using it, it gives priority to us first, and then once we're not using the system, it goes to the community. So that's one way with this setup that we have. We also have been using telemedicine to do things like teleophthalmology. For diabetic patients, they need to get retinal scans every year, and we are able to use AI to see whether there are changes in the retina. And that has been helpful in managing our diabetic patients. We also do telepathology. We have been able to reduce the waiting time for a diagnosis. So as of last year, we have moved that from 3 months to now between 3 days to 7 days. And that's a marked improvement, because think about somebody having a biopsy and having to wait 3 months to know whether this is cancerous or not. There's lots of anxiety waiting that long. So by reducing the waiting period, I think that's helping people to understand what is going on with them.
Become more confident. So you raised that. That's an interesting point you're raising. So say someone gets sick, they don't know what's really wrong. It might be a rare disease, or it might be a common cancer, one of those that come up. Prostate cancer, I think, in this country has been on the increase, and other forms of cervical cancer, for example. There's been issues, and I've heard you talking about them. So tell me about our capability in terms of testing and labs, and how, what do you see new happening there? How is that landscape going to change?
It's going to change drastically because we have a national public health reference lab, and in each of these new hospitals, they'll have their own lab. Plus, we currently have a number of regional labs. All of this is going to be networked, so we can move things seamlessly. This year, we're building out a system where we can move samples quite seamlessly, and of course, when you're moving samples, you have to move it in the right conditions. So that you will see that happening with the new system that we're putting in place. In addition to that system, we have targeted the National Public Health Reference Lab to make it a level 3 lab, which means we can handle different types of pathogens that we can't handle right now. And if we're going to practice modern type of medicine, then we have to do molecular surveillance of disease. So we are working on equipping a section of the reference lab to be able to do molecular surveillance. So you'll see a lot of improvement, the types of things that we can test for and so would improve significantly. The new pathology lab that we have, we can actually do a lot of markers for different types of cancers. So let's say somebody, we had a breast biopsy done and it came to us. We can diagnose what type of breast cancer you're getting, and we can also do the differentials, right? So there are different markers that you can look at, and we have the capability now of doing all those differentials. And this is something that didn't exist. So the most people would have known is that, okay, this, you have a lesion in your breast and this thing is cancerous. But beyond that, what type of breast cancer you have, we weren't able to say. So we couldn't do the differentials. Now we are able to do those differentials. Similarly, for prostate cancer, we are working to, first of all, expand the amount of screening that we can do. Last year, for example, for the first time, we were able to do more than 10,000 PSAs.
10,000.
More than 10,000. And we, as you would know, last year we launched a special program to do HPV testing. So we were giving women a voucher, and they were able to go to any one of the labs and use that voucher to do an HPV test. And we did more than 11,000 HPV tests last year. And everybody who tested positive, we have brought them into the system so that they can follow a protocol that we have developed. And we'll be able to monitor them or to see whether they have changes in the cervix and address those changes. So it's an exciting period now because we're doing these things and we can prevent a lot of diseases from actually occurring or their complications. And that's making a huge difference. I don't think people realize the impact that this would have in another couple of years.
Yeah, and you also recognize in the budget that you're going to increase screening from an early age, school-age children,
Yes.
and those kinds of. Tell me a bit about what you see happening this year in terms of young Guyanese in the school system getting tested early for what particular thing? What kind of data are you looking for in terms of these tests?
So this is a program that we started about a year and a half ago, and we started at nursery school. What we were doing for these nursery school children was to check their eyes to make sure they're seeing well, check their hearing, do a dental checkup for them, and then do a general checkup for them to see whether they have any problems. And we did about 20,000 nursery school children up to last year. And then we started primary school children. And we've already been picking up children with various types of difficulties. And once we pick up whatever it is, we bring them into the healthcare system and we take care of these things. So that has really worked very well. And now what we want to do is to make sure that we continue this. So this year we are going to expand it. We're going to go into nursery, not just nursery, but primary and secondary. So we want to expand. So a child coming to school now would have at least a test done once in nursery, then again in primary and again in secondary. And we'll pick up things along the way and be able to fix it before it becomes a problem. So that's really preventative medicine at its best, right? And this program, we've been working with Mount Sinai out of New York to roll this program out, and we get a lot of technical assistance from them. A lot of their experts have been helping us to assess the data and things like that. So it's a very ambitious program because once we max out the full potential of this program, we'll be seeing maybe about 220,000 children a year. So that's quite a lot of children.
Yeah. Are we moving? Are we moving towards the universal healthcare in this country?
We are.
Yeah.
Yes. because, you know, one of the other things that we did, Guyana, we have a tiered system, right? So health post, health center, um, district hospital, regional hospital, and so forth. So we have set ourselves as a government that at a health center level, we must be able to offer at a minimum 115 different types of interventions. And we're working towards that. Most of our health centers now are able to do what we call hearts because this is a chronic disease that we want to minimize the effects of. That's hypertension and cardiovascular disease. So we have right now more than 200 health centers with this program, and this year's budget, we're trying to cover the rest of them. So there are lots of exciting things that we're doing.
Yeah. You know, it's no secret that in Guyana,
Mm.
we've suffered from a brain drain over
Yeah.
the years. How is this budget going to help reverse that? I mean, get some of those trained,
Yeah.
experts, even the ones we have, like, I mean, upping their skill abroad, if it means training abroad, hospital administrators and so on.
Yeah.
How is this budget going to help in that respect?
So I think two ways. One, the doctors who've been trained here, we actually have a very good postgraduate program where we train people in about 20 different specialities. And we found from those programs that people actually are staying. So they're not migrating and going away, which is a very positive thing. But outside of that, we have also been sending our doctors to get fellowship training. We have a good partnership with McMaster's. We have a good
In Canada.
partnership with,
Oh.
yeah, in Canada. And we have a good partnership with Northwell in the US. So recently we had a doctor that went up to New York and did urogynecology, and she's back at the Georgetown Hospital and offering those services because we didn't have anybody trained in that particular area. And we are exploring other partnerships. We recently had some discussions with the European Union to be able to open fellowship possibilities in the EU. In terms of hospital administrators, we've had a partnership with York University Schulich School of Business. We have trained so far 60 health administrators, and we have trained at least 30 physicians in a physician leadership program. So these programs are going to continue, and again, we're looking at various partners to continue doing them.
Obviously, to keep that staff, you have to pay them
And we have been doing
a
that.
competitive salary.
We have been doing that because, you know, about 2 years ago, the government increased salaries for all healthcare workers, all the clinical healthcare workers. So salary went up tremendously, and it has made a big difference
In retaining staff.
in retaining staff. And we expect that more and more people are going to come back into the system. And we are seeing some signs of that. And for one of the interesting things that I've seen over the last couple of years, there are Guyanese doctors and nurses who have done very well for themselves abroad. And they're now returning and trying to see, even if they can't come back permanently, how they can work along and what in what area they can do something. Up to last week, I had a visit from one professor who is in the area of respiratory therapy. And she came back, worked with our staff, and they've developed a bachelor's program for respiratory therapists. So very soon, that's something that the ministry and the University of Guyana would launch, and we're hoping to start with a batch of 15 persons. So people are coming back. They're bringing those skills back, and they're looking at areas where they're very competent in and helping us to build those areas in Guyana. And I really welcome that because the experience and the skills that they have acquired over the years we can benefit tremendously from that.
An area that is close to my heart that I saw in the budget, one of the line items in the budget is communicable diseases,
Diseases,
right?
yeah.
Malaria,
Yeah.
dengue. Tell me about what you could do this year. I know you've done the fogging program, the mosquito, the nets, what do you call that? Mosquito net program, distribution, and so on and so forth. What more will this administration do? Will your ministry do this year with the funding you've gotten to reduce incidences of communicable diseases?
So, one of the things that we've been working on is to eliminate filaria from Guyana. So filaria have been with us for more than a century. You know, people know it as Bigfoot,
Right.
right? Because that's when you get elephantiasis, and it's really a horrible thing because you know it looks bad and whatever. So we have been working over a number of years to eliminate this from Guyana. We're on the, almost on the cusp of elimination,
Wow.
right? In 10 of the 10 regions, we have eliminated this from 8 of them already. And in regions 3 and 4, we saw that it was a little bit above where it should be. And last year, we went back and did mass drug administration of the meds so as to reduce the burden of this disease. This year, one of the things that we'll be doing is doing an assessment along with the CDC in the United States of America and a Canadian team. And once that assessment shows us that we are below that level, then we'll continue for the next 3 years and we will be certified by the WHO as having eliminated a disease.
Wow.
So we are on that trajectory. Now,
It's amazing.
similarly, apart from filaria, we have a program where we are working to eliminate leishmaniasis from Guyana,
Tell me what that is.
or Busheyaz. So Busheyaz, sometimes you get like a sore, and then it gets worse, and it basically eating out your flesh.
Wow.
People in the interior, some of them.
Is that
they-
mosquito borne as well?
It's caused by a parasite, but we have been working to eliminate this, so we're now seeing less than 50 cases a year, and we feel very confident that before 2030 we can actually eliminate this from Guyana. There's another disease called Chagas, and again, we want to eliminate this. That one can give you a heart condition, and it can affect your eyes. And we do see a few cases, so we're working to eliminate that as well. Leprosy, which is a very ancient disease, we still have
We
cases
still
in
have
Guyana.
cases. Wow.
At one time, Guyana had a leprosarium,
Yes.
and that leprosarium was up at Mahaika.
Yes.
And now we are working to eliminate completely this disease from our country. And again, we are on track before 2030 to eliminate this from Guyana. So there are a number of infectious diseases that we would eliminate from the country. Not just control it, not just try to manage it. We're working to eliminate it from the country, right? So we don't have to bother with that again because we have eliminated
Yeah.
it. Outside of those, we had started a program for hepatitis C. Now, people previously diagnosed with hepatitis C, we weren't treating them because the meds were too expensive. At one time, it would have cost maybe $20,000 per patient. That came down to about $1,500. So we have a program where we're buying the meds and we're treating people with hep C. So far, we have cured more than 50 people. And that program is going to continue. Now, if we didn't cure them, in about 10 to 15 years, they'll develop liver cancer. So that's why it's important for us to address the problems now, which we're doing. So that's a new program that was started maybe about 2.5 years ago. Malaria is a old foe, if you like. And we have a number of programs that we are working, like the ones that you mentioned, fogging, using bed nets. We have distributed last year maybe about 150,000 bed nets in homes across the interior. We have special nets for minors. These are hammock nets, so you put it over your hammock. And we have been giving these things free of cost. We have a program with minors too, where we're working with them. We give them a package, so they'll have a kit, a rapid kit that you can diagnose malaria with. And if it's Vivax or falciparum or mix, then you have different packages of medicines that you can use. And we have simplified on the package to tell you day one, you use this and this medicine. Day two, this and that. So it's very done very nicely. So that too, we feel very confident that we'll get control. But last year we started addressing a strategy not to control malaria, but to eliminate malaria from Guyana,
Well, yes.
right? And so we'll be exploring that a little bit more this year and putting that into action. So we are very confident that this is possible. And it will take us a couple of years to achieve it, but it's something that we can do because from a technical point of view, it can be done. And we've seen it done in other countries, so we want to adopt some of that. And we brought in one of the experts who would have helped countries eliminate malaria to work with us. So that's something that we'll be working on.
Talking about these collaboration ideas and programs that you've done, I read a couple of months ago about the Qatar team coming to do heart surgeries, and apparently there was a delay, but there's a great deal of people on the list to get open heart surgery or heart interventions. And tell me a bit about what that can, because the world of medicine is actually shrinking in terms of the world is huge, but there's a lot of sharing of ideas and expertise and things like that. What advantages do we have as a country when these teams come in to do these kind of collaboration with our doctors in Guyana?
So, for example, that particular team that is going to come, they're talking to our technical team at the hospital, and our team has identified some of the cases. They have shared the information of the patient, and they're doing all the technical assessments. So when the team comes, there are very little technical work that they have to do. And so they go right almost immediately into surgery because the patient would have already been worked up. And so we're trying to build those types of collaboration, and we have this new partnership that we're working with Qatar on. And I guess once they come and they work with us, that it wouldn't be a one-off arrangement, but we'll see visits, repeated visits by them as we work together. Now, the benefits of visits like this is that very often for a technical team, they're training the technical team, building capacity to do certain procedures that we probably are not doing right now. And in some cases, with some of the teams that have come, they donate equipment, highly specialized equipment. Some of them are extremely expensive. So some of these teams tend to donate that. We also have a team that over the last, I would say, 3-4 years have been coming to Guyana to do joint implants. And this is a team out of Maryland, and they have done a fantastic job. Last year they were here, they did maybe about 60 knees and hip joints. So that's a lot of good work, right? And when they come in, they bring the implants, and they're able to work with these patients. Our doctors have benefited from that experience, so much so that we now have doctors trained. We can do them on our own. And we have extended that type of operation where we are now inviting colleagues from the Caribbean to come to Guyana to learn how to do implants. So, people help us to build that capacity, and then we are sharing what we've learned with other people as well. So there are lots of good things that are happening in the health sector.
I want to end by asking you about mental health, and it's been a real challenge in this country. We've trained over 600 healthcare professionals, practitioners to recognize, to intervene, and so on and so forth. We have, I think there's a new hospital coming on stream soon in New Amsterdam, if I'm not wrong. Limited, I think, though. But I mean, what do you hope to do this year with the new budget?
So we've been improving mental health. We now have about 16 trained psychiatrists in the country. There were many regions in Guyana where they had zero psychiatric service. We have been now sending some of the doctors to go to those regions to do clinics in the region. Some of them are not permanently there, but at least you can get some clinics done. We have also used this network of telemedicine sites to do telepsychiatry. So if we have somebody in one of these outlying areas that got some problems, they can come to the health center and the community health worker would link them to a psychiatrist at the hospital. When the psychiatrist speak with the patient, if they feel there's a need to do follow-up or maybe to do further evaluation of that patient, the ministry would then fly that patient out to Georgetown, where that follow-up evaluation would be done and treatment would be offered. So that's another thing that we're doing. We have changed how we want to practice psychiatry. Before, people want to lock people away, and that's not the right way. Most psychiatric conditions, you would have an acute period, and during that acute period, you need to be managed. And so all our facilities now, hospitals and everywhere else, we're preparing for acute periods. When our patients have acute periods, they'll come in, they'll be hospitalized, we'll treat them like any other ailment. We'll treat them, and then they go back home and continue their treatment. So once they're on their meds, they should be fine. We have also been training our primary healthcare physicians to make sure that they understand, and when they interview patients, that they're able to talk to them about mental health issues. One of the things that we sometimes miss is depression. And if someone is depressed, we have seen a close correlation between depression and suicide. So we have trained our physicians to talk about these things and to be able to detect them. They can offer first treatment, and if they think it's a more complicated case, then they refer those persons to the hospital. We have also, through a Canadian effort with IDRF and funded by the Canadian government, we have been doing gatekeepers training, where we're actually going into the community, working with community leaders and training them on mental health issues. So, if somebody got a problem, they can go to the community leader, and then they're trained to do some basic things and bring them into care. And I think that has been working as very well. We've done manuals and things like that, and it's changing. It's going to take time, but it's changing. And I think that's what we have to keep working on.
So God willing, next year, 2026, we're sitting here having this conversation, looking back on 2025 with $143 billion in your coffers, the Ministry of Health. What do you expect to see or be able to tell me or the Guyanese people in 2026 about when you look back about what you've accomplished this year?
When we look back, for sure, you'll have 6 hospitals that would be operational, so which means a lot more services would be given to people around this country. Some of the other projects would be fully advanced. We have something that we didn't talk about, but we should have electronic records being deployed, telemedicine, more sites with telemedicine, expansion of the services that we are offering. So there will be lots of positive stories. And I think the population would experience that difference because of these investments that we're making. The whole thrust here is to keep people healthier, and when people come to get services, that they can do so in a good environment and get that service in a very timely manner. So that's our intention. That's what we're working on.
Dr. Frank Anthony, thank you so much for your time this afternoon, and thanks for walking us through this budget and what it means for health in this country. Thank you.
Thank you very much for having me.